A new report touts the positive impact of Medicaid expansion in the state of Montana. This is a report made possible by the University of Montana Bureau of Business and Economic Research. It points first to the positive impact in jobs. When the state instituted a Medicaid expansion program, they saw 5,000 new jobs created, a 6% increase in the labor force, and an overall increase of about $280 million in new personal income. They saw that the state's expansion program started getting people healthier and back to work. And they think it's going to keep paying for itself. As Medicaid expansion continues, the state is asked to contribute a little bit more than they did in the initial years. The federal government picks up all of the cost of Medicaid expansion in the early years of implementation and scales back to 90% over time. Montana says that's going to pay for itself. We've already seen the positive impact of Medicaid expansion. Now, we're coming up on a deadline, though, in the state of Montana. Medicaid expansion is set to end in 2019 unless their legislature votes to continue it. This came in the form of legislation in the state to institute it in the first place. It did have a renewal date set, and we have got a Republican legislature that is seriously considering whether or not they want to move forward. Now, it seems like a no-brainer. The research is showing us this is a good idea, but politics being as they are, you can see how conversations might get a little sticky. We've got a Republican senator that was an original co-author of the legislation to expand Medicaid that is still in favor and trying to round up the votes. We have a Democratic governor doing the same, agreeing that this is a positive thing. Now, there are some fears as well that conditions could be put on the Medicaid expansion like we're seeing in other states, maybe adding premium requirements or work requirements or even drug testing in order to, as a condition of continuing Medicaid expansion. That has yet to be seen if that's going to be implemented into the new legislation that would be required to renew the program. We have lessons from other states saying those extra requirements and hoops and hurdles end up hurting the population that's in the Medicaid expansion. So hopefully they can take a nod and learn from the failings of some of those other states and keep a little bit cleaner Montana program running. Now, Medicaid expansion covers about 90,000 people in Montana. It's curious if work requirements will replace incentives that are there right now. Many people are hoping that instead there will be incentives to find work instead of a mandatory requirement that you be working to get Medicaid. Now, this is not the only report in recent history about that's touting the benefits of Medicaid expansion. And coming out of other states, not just Montana as well, there are reports pointing to the significant coverage gains made when a state expands Medicaid, improve access to care, reducing the number of uninsured, improve utilization and affordability of care, reduced crime rate, reduced medical debt, and the list goes on. You can read for yourself that literature review of the benefits of Medicaid expansion made available by the Kaiser Family Foundation. You can also read that research report coming out of the state of Montana yourself. We make both of those links available. If you have questions or want to join this conversation, you can always do that at healthwatchwisconsin.org. Thanks for joining us.